Hello guys, this is Vamshi Krishna. Today we will see some of the basic questions for upcoming staff nurse recruitment examinations. So these are all the questions are made from the previous question papers from the central government, NORCET and JIPMAR, so like that. And the first question is keloid formation is due to. So what is the meaning of keloid and what is the keloid formation? So in this picture, you can see the injury site has some bump like structure. Okay, so this is called keloid formation. So if you see the options here, so it is due to the formation of excessive wound drainage, okay, and excess of collagen formation and platelet aggregation. None of this. So what is the reason to behind occurring of this kind of situation for the person? So when the injury is happen, so that is the meaning is excessive of collagen formation at the site of injury. So this is a abnormal condition. Okay. So for the wound healing, we need mostly nutrients and macrophages to kill the pathogens which are present at the injury site. So at the same time, collagen also really important for the formation on a normal tissue. Okay, so in the condition of excessive collagen formation, what will happen? Keloid formation will be taking place. So this is called keloid formation. Okay, so the next question is which one is the fifth vital sign? Okay, so we have the four vital signs. So what is the fifth vital sign? Options are temperature, blood pressure, respiration and pain. So this is the right answer. So fifth vital sign is the pain. The next one is breastfeeding should be start within how many hours after normal delivery? Options are within half an hour, within 4 hours, within 2 hours, within 24 hours. The right one is the within half an hour we should initiate the mother to give the breastfeed for the baby. So the next one is route of drug administration vitamin K injection in the newborn baby. So what is the route of drug administration for newborn baby? That is vitamin K injection. Options are subcutaneous, intramuscular, intradermal, intravenous. So the right route is the intramuscular. So that is upper part of the thigh for the newborn baby. That is route of drug administration of vitamin K injection. So the next one is what is the normal temperature of healthy newborn? So what is the normal temperature for the healthy newborn baby? Options are 36 to 37 degrees centigrade, 36.5, 37.5 degrees centigrade, 37.5 to 38 degrees centigrade, 38 degrees centigrade. So the right option is option B. So that is 36.5 to 37.5 degrees centigrade for the healthy newborn baby. So the next one is normal average length of healthy newborn. So what is the length of healthy newborn baby? Options are 40 centimeters, 50 centimeters, 60 centimeters, 80 centimeters. So the right one is the 50 centimeters. So 50 centimeters is the right and a normal healthy newborn baby will have the length. So the next one is joints between two cranial bones are known as. So we know that the joint between the two bones are called joint. Okay. So when you have the skull bones, okay, so here we have the skull bones and the joints between the two skull bones. What is the name of this joint? Options are fontanellas, bregma, suture, skull joint. So the right one is the sutures. So these sutures are called fixed joint. We can see in the skull bones. Okay, here you can see the sutures. So these are called sutures between the two cranial bones. The next one is Uterus become pelvic organ after how many days of delivery? So after how many days of delivery, the uterus become pelvic organ? Options are 18 to 20 days, 16 to 18 days, 12 to 14 days, 10 to 12 days. The right one is the 12 to 14 days. So after the delivery, the uterus will become a pelvic organ. It will take a time, that is 12 to 14 days. So the next one is the diameter of the cervical canal after complete dilatation. So before expulsion of the baby, the first stage of labor is the cervical dilatation. So what is a uh, normal diameter of the complete cervical dilatation? Options are 12 centimeters, 10 centimeters, 8 centimeters, 6 centimeters. So the right one is a 10 centimeters. So this is the cervix. Here we can see the dilatation. This is 10 centimeters. So the next one is the normal distance of clamping. Okay, the normal distance of clamping of umbilical cord should be. Options are 2.5 centimeters, 5 centimeters, 7 centimeters, 5.5 centimeters. So the right one is a 2.5 centimeter. So the umbilicus will be the connection between the placenta and baby. Okay, the umbilicus will be here. So this is the umbilical cord. So you have to clamp the 2.5 centimeters away from the umbilicus of a baby. So this is the normal distance of umbilical cord clamping. The next one is maximum score of Apgar scoring. So what is the normal and the maximum score of Apgar? Options are 8, 10, 13, 23. So the right one is the 10. So in the Apgar score, we will have a maximum score, that is 10. The next one is a goniometer is used to assess. So what is the use of goniometer? Options are auditory function, muscle strength, range of motion of joint, visual acuity. So the right option is range of motion of joints, to measure the range of motion in the joint, that is used by the goniometer. The next one is lateral curvature of spine. So here we have the lateral curvature. I am asking lateral curvature. Options are kyphosis, lordosis, scoliosis, none of this. The right one is a scoliosis. So scoliosis is nothing but lateral curvature of the spinal cord. Here you can see the picture. So in this picture we have the different types of vertebral abnormality. So this is the normal vertebral column. So when you see the scoliosis condition, the lateral curvature of the vertebral. Okay, so it have the right and left curvature of the scoliosis. Scoliosis in the scoliosis only we have the right and left abnormality, and thoracic and abdominal abnormality we will have. So in the case of kyphosis, this is posterior curvature of the vertebral column. This is called kyphosis. And the last one is the lordosis. Lordosis is the anterior curvature of the vertebral column, is known as the lordosis. So in the vertebral column we have the scoliosis. In the scoliosis only left and right, thoracic and abdomen. In the kyphosis, posterior curvature. Lordosis is the anterior curvature of the vertebral column. So the next one is which nutrient is help for the tissue repair. So when the person or any animal got the injury, So which nutrient is really helpful for the tissue repair? Options are lipids, proteins, carbohydrates, vitamins. So among the four nutrients, the proteins are mainly responsible for the tissue repair. The next one is a movement of a body part away from the body midline is known as. Okay, the movement of body part away from the midline. So if you see the human body, the midline is the center part of the body is called midline. So here the question is the body part is going away from the midline. What is the name of this movement? Options are abduction, adduction, extension, pronation. So the right option is abduction. So abduction is nothing but movement of a body part away from the midline. The next one is highest BMR is found in boys because their body contains. So what is the reason of having highest BMR rate in the boys? Options are thyroxine, estrogen, progesterone, testosterone. The right one is a testosterone. So in the case of boys, the highest BMR rate is due to the having testosterone. The next one is the apex beat is felt at which intercostal space? Options are third, fifth, sixth, and seventh. The right one is the fifth intercostal space. So when you auscultate with the stethoscope, you can hear the apex beat at the site of fifth intercostal space. The next one is which color identification band is used for the newborn girl baby? Options are blue, pink, green, and yellow. The right option is pink. So pink color band we can give for the newborn girl baby. The next one is what is the average length of ureter? Okay, so what is the average length of ureter? Options are 15, 18, 25, 32 centimeters. The right one is the option C. This is 25 centimeters of normal ureter length. The ureter is the pipe connection between the kidneys and bladder. Okay, this is called ureter. The next one is what is the number of carpal bones in one hand? So here I am asking one hand. Options are 8, 3, 6, 10. The right one is a 8. So in this picture you can see the carpal bones here we have. Okay. So here we have the total 8 carpal bones in one hand. For both hand we will have a 16 carpal bones. So these are the carpals, these are the metacarpals, these are the phalanges. Phalanges are nothing but finger bones. The next one is total number of intercostal muscles in the human body. Options are 11, 12, 24, 28. The right one is a 11. So 11 is the number of total intercostal muscles. The next one is exclusive breastfeeding is recommended for up to how many days or months or years? Options are up to 1 year, up to 6 months, up to 9 months, up to 3 months. The right one is up to 6 months only. The mother has to give the breastfeeding, only the breastfeeding for the baby. That is exclusive breastfeeding. The next one is a proper medical abbreviation for before meal. So when you advise a medication for a patient, that is before meals you have to take the medication. So in the case sheet the doctor has written which abbreviation. Options are OD, BD, AC and TID. The right abbreviation is AC. AC is nothing but before meal. OD means once in a day. BD means this is BD. BD is a twice in a day. TID means thrice in a day. The next one is, and this is the final question, the final step of purification of water in large scale. Options are filtration, storage, boiling, and disinfection. The right one is the disinfection. So this is disinfection is the final step of water in a large scale. Large scale is nothing but big tanks in the community areas. So that is final step is the disinfection. So thank you guys for watching my video. Please subscribe and share with your friends who are preparing for the staff nurse examinations.